So when someone presents with degenerative changes of their neck, and radiographic terms to describe that could be cervical stenosis, cervical disc bulging, herniated disc. When you get arthritic changes of your neck or degenerative changes, you can present with neck pain. And that pain can be referred in the back of the neck. It can go out to the shoulder blade area or even to the top of the shoulders. That's not a pinched nerve. That's just pain referred from a worn out part of your spine. So those same degenerative changes, however, can also cause problems with the nerves of the neck, okay, or the nerves coming from the neck. So these degenerative changes can narrow the nerve channels. And when they narrow the nerve channels, you can get neurological complaints related to those degenerative changes of your neck. There are two broad categories of nerve issues that can develop from your neck. You can have compromise of the channel for an individual nerve going to either the right or the left arm. And when those nerve channels get narrowed and they irritate the nerve, patients will complain of pain that can radiate down the arm. They can also complain of numbness or weakness in the same distribution with that nerve travels. So that's an individual pinched nerve scenario, and it's clinically referred to as a radiculopathy. The second and more concerning from our perspective, from the clinician's perspective, the more concerning type of nerve issue is when the spinal cord's involved. And when the spinal cord channel is compromised, you won't necessarily present with pain. More often, you're going to present with more global issues because the spinal cord is the main cable from the brain to the rest of the body. And kind of the classic symptomatology related to spinal cord problems is patients will describe tingling in the fingertips. They'll get loss of hand coordination. Their hands get clumsy. My handwriting is getting sloppy, or I have problems opening up a jar. They can get focal weakness in their upper extremities or their arms. And then they'll complain of things like gait instability. When I'm walking down the street, it's not that I feel dizzy, I just feel like I'm walking on a boat. I feel unstable. And then the other issue that can develop is if it gets severe enough, they can have bowel or bladder symptoms, and it's more often bladder issues where they get a sense of urinary urgency. They have to get to the bathroom quickly, otherwise they feel like they might have an accident. If we had to prioritize these issues from our perspective, the spinal cord is the most concerning because that has the least capacity to resist any type of injury or irritation. Then next would be an individual nerves channel narrowing that can cause numbness, weakness, or pain in a specific extremity. And then finally, although we don't want to minimize a patient's pain complaints, from our perspective, the least urgent type of situation to deal with is just generalized neck pain.